I also really like that I'm always thinking education and big picture and everybody using this as quickly as possible. And I love the fact that you give doctors the option to put in their best guess. I see that as a great opportunity for education for doctors about, how close to the bullseye did I get it? And if they've used a report a few times, they will start to see, I'm probably a little bit off every time.
I think that's really important, but it's also important because the doctor knows the patient, and they not only can they put in their best guess, but they may want to say, I'm not going to, here is some drugs that I'm not going to use because the patient has heart disease or some other reason that the doctor feels that it would be contraindicated to use certain drugs. So we can substitute those drugs, or we can simply take them out and give the best, because the doctor knows the patient. And so we can give the best match omitting certain drugs if the doctor feels that that drug may be a problem for the patient for other reasons, kidney disease or heart disease, or whatever other health problems the patient has. So there's a lot of ways to customize the report. And then the other thing I want to emphasize is that the intake can be any type of genomic testing. So we're not wedded to
Tumor DNA or something.
right. It can be DNA or RNA, and we're not wedded to one specific company. Whatever testing, and it could be that a patient has multiple tests done. We've seen patients that have gotten test results from several different vendors. We can input all of that. So the more data for us, the better. And we're not restricted to data from a certain format or a certain company.
Excellent.